Well, I have found it, like I said, very reassuring, and I think that that if other women find it as reassuring as I did, then it's definitely worth doing. For some reason, I never really thought about not having the screening. I never thought about... I think because I was looking forward to having anyone pay attention to me, give me a little attention, I was really looking forward to things like the 12-week scan, and they became markers that I got to say, oh, just 3 more weeks until, as opposed to saying, oh, just 33 more weeks until the baby comes out. You get these shorter time frames. And so, as silly as it sounds, that's a lot about what screening did for me.
So on the Friday morning, we went to the NHS hospital for the anomaly scan, and my expectation of that was to be told that everything was fine and the sex of my baby, and that was all I thought was going to happen, because there couldn't have been anything wrong, because everything so far had told me that everything was okay. And even though I read the leaflet that said, this condition and that condition, and none of it really sunk in, and it wasn't... Everybody had suggested to me that the scan was to make sure everything was right, not to tell me what was wrong. And I can look back and think how stupid I was that I didn't actually stop and think, why is the NHS investing this money in me if everything's going to be all right? I mean, they're doing it for a reason, and the reason is the negative reason rather than the positive one. But I just didn't... Neither of us thought that. We just didn't think that at all.
We arrived for the scan, and as usual, the appointments were running late, so then I was focusing on the fact that I had a very full bladder and was feeling deeply uncomfortable and wanted to hurry up and get it over and done with so that I could go to the loo. The lady who was doing the scan, she wasn't a doctor, so she said that she couldn't discuss the scan with us. And so she started the scan, and she was very, very quiet. She didn't say anything at all until the end of the scan, and she said, I think there may be a problem. And we of course asked her what the problem was. She said that she wasn't able to discuss that with us because she wasn't a doctor, but she would refer us to go and see a doctor who would discuss the results of the scan with us.
Just going back a little bit to this ultrasound technician, and when she said she couldn't discuss the results, she did say that before the scan, that she wouldn't be able to discuss the results? Or
she didn't actually. She said it at the point where she went very quiet, where she stopped saying things like, and there's the leg, and there's the arm, and there's the head, and there's your baby's tummy. Then she went very quiet, and it was at that point she said, I can't discuss the results of the scan with you.
Oh. So you haven't been because one option is that, yes, staff are quiet during the scan, but if they explain beforehand that's what they're going to do, then it's less anxiety creating. But that wasn't your experience.
No, we did realise that there was a problem by the fact that she suddenly became very silent.
And how did you feel about the way that she presented what she thought she found at the end to you?
I guess at the time I felt very numb and almost a little bit cross with her for presenting me with a problem that she couldn't discuss, and because I didn't understand the significance of the probability that she gave me, the fact that it was 1 in 20, I guess I was in denial, and I convinced myself that there wasn't really a problem, and why was this lady creating a problem for me? I was looking at it, I guess, from a different perspective, and the fact that I'd gone into the scan not really understanding what they were doing and what they were looking for, and I guess very naively, and I was focusing on the fact that this pregnancy was bound to end successfully, and in a few months' time I would be holding my baby, and that wasn't her focus. Her focus was that she was there. The purpose of the scan was for her to look for a problem. So she was focusing on the problem, and I was focusing on the baby.
And the discussion about risk you touched on earlier, I mean, how clear was it to you, all these different figures that you were being presented with? Did you feel that you had an adequate understanding of the risk information you were being given?
It was meaningless. It was meaningless because you don't think about risk is meaningless. What actually would have been useful would be to say, compare it to, well, what's the risk of me having an accident if I get in a car? Mm-hmm. And what's the risk of me, being knocked over as I walk down the street? And in that context, it would have meant more, because you don't deal, or me falling down the stairs in the house, or there are all kinds of things that you hear about that are risks that we live with every day, that we completely live with and ignore.
Sure.
And so all of a sudden you had to make a decision about something based on information that you never normally use.
I suppose, although, I think, as I understand, it's sort of anything above 1 in 300, is considered high risk. And, they seem quite large odds sort of thing. So, it's like it says, you don't know how that compares with anything else. And like I say, I don't think one goes through life thinking all the time, what's the risk of knocked over by a boss or whatever. But I guess if they had said, there's a 1 in 4 risk, you probably would think.
Then you would that would be meaningful. But I think it came out as something like 1 in 60.
And there were issues about giving different risk factors by different people, and that's what got a bit upset about.
That was very confusing. That was really confusing. That there were all kinds of risks attributed to the same thing.
Yeah, so the midwife
would say there's one list of risk factors, and then there's another list of risk factors for exactly the same thing in terms of Downs, because it's all assessed in a different way and depends on what stage of pregnancy you're at.
The experience with my last child was very different with the scan, because most of the way through with the hospital appointments, and particularly with one radiologist, it was very negative. When I actually had the scan, she couldn't see the whole of the backbone, and she said, just because of the way the baby was lying, there was no particular thing about that, but she said with anyone else she would have called them back. But she wasn't going to do that with me, because I'd already, I'd made a decision not to have anything done, so it would be a waste of time and money, and she wasn't going to do it. And I was really upset. My husband was furious. And of course I spent the next few nights just imagining the worst possible scenario and what there could be and how we were going to handle it and all that sort of stuff. And in fact I was so upset I didn't even mention it to my midwife for some time. And when I did, she absolutely hit the roof, because she said nobody should be treated like that. It doesn't matter what decision you make. If you make a decision, then it's for the hospital and the staff to work within that, not to try and put their judgments onto you.
One of the elements that went through our minds was the with CVS there is a risk of miscarriage.
Yeah.
Which is it 1 in 100?
Yeah, they say
There's
1
in 100 risk of miscarriage, albeit that's the nationwide statistic. And although they don't publish it, the impression we get is that the hospital we went to, probably because of the people who were involved there, actually had sort of a better risk analysis, if you like,
Yes.
of not having miscarriages.
Our consultant explained to us that it's a national average, and they group in doctors that do it once a year to doctors that do 20 a day. And where we went, they're doing them all day. And he said, really, we can't publish the actual risks because we have to go off of a national average. But he said, he mentioned that he does a certain procedure that it's a 1 in 100 risk, but he said his actual risk is 1 in 4,000. So that reassured us. But we were terrified that we would miscarry a healthy baby by having this invasive test. And we were frightened, but the odds were so poor that we thought, we're going to have to risk it. The risk obviously was worse for an abnormality than it was for the miscarriage.
He did actually say at the time, as he was starting to scan, I think he's a rough sort of précis of what he said was, I'll be talking to my assistant, I'll be saying things, don't worry at all about what I'm saying, I'll explain everything to you fully, but switch off completely to what I'm saying. And then he proceeded in quite a precise and fairly sort of strong voice to list off this huge long list of... and of course I'd spent, because we'd had the weekend, hadn't we?
We had.
In between the first 2 scans at our local hospital. And I'd spent the weekend on the internet, so all these things that he was listing off as problems, I'm thinking, yep, I've heard of that, yep, I've read that one, yep. Our consultant at one point, when we were going through this, and I'm saying, well, yes, what about such and such and such and such? And he's saying, he actually turned around to me and said, look, in fairness, you probably know more about Bateau syndrome than I do. Which was, that at that point that was an admission that it's a learning curve for everybody, and they don't necessarily know how to... Is there a right way or a wrong way to deal with somebody who's been told that their baby's going to die?
And looking back to that specialist scan, were you happy really with the way that it was handled, or would it have been better to be involved from the start rather than having the list of things reeled off?
I don't know. It was so intense. And I only ever felt that he was doing his job to the best of his ability.
Yeah.
Not that he was trying to hide things from me. He wanted to get everything, and the trouble was, if he'd have said to me, oh, there's an abnormality with his brain or with his head, I'd have been like 100 questions about that one thing, where that would have held up the rest of the scan.
Yeah.
So with
he did
him,
have a job to do. I mean,
he scanned me very professionally. He was very nice. He did say to me at any point that I wanted him to stop, he would have stopped. He was great, and I did
box
feel...
of tissues was always handy, wasn't it?
I did feel that he was very professional about what he did, the way he spoke, and the way he spoke afterwards was great. There was no rush, there was no nothing, and he explained every one of his symptoms thoroughly, and he could do it better that way than trying to do that whilst he was scanning, although the upset was there.
So what was the CVS like?
It was awful from my point of view. He explained to me what the procedure would entail, and I was terribly, terribly worried about causing the miscarriage myself by moving whilst they were inserting the needle. So I was very tense, and I guess that makes the procedure more painful, more uncomfortable. because I just didn't want to move even a fraction of an inch and cause that needle to touch the baby. So I can remember I was crying silently and just gritting my teeth and clenching my knuckles and just hoping that everything was going to be okay.
And what did it actually feel like?
Well, they told me that it wasn't painful, but I disagree. I think it is painful. It's not like having an injection, although it seems as though it should be. They insert a needle through your abdomen and collect a sample of the placenta, the tissue around the placenta. And it felt what I imagine being stabbed with a sharp implement. It had a sort of pressure to it. But it was the pain only lasted while the needle was actually going through my skin, and then it was just uncomfortable as I was aware of something being inside my abdomen. Only lasted a short time. So I don't know, a minute and a half.
And then the results came, which was another Friday.
It was. There was a midwife from the hospital who rang me and said, unfortunately, the results of the CVS show that your baby has Down syndrome. And that was hard because I was by myself, and I was trying to deal with what she had told me, and I was also trying to think about what information I needed from her to help me make the decision. She was one of the most helpful professionals that I came across throughout the experience, and that she did help me to ask the questions. She did ask me what my experience of Down syndrome was, or had I met any children. She asked me if I had any concerns and did I need any other information. So she did sort of prompt me. She didn't get off the phone as quickly as possible. Yes, but I was completely devastated.
I suppose the other fact as well is it didn't really matter whether it come back Downs or not, because we'd already sort of knew that Downs wasn't an issue, so
I think by
have it.
By 20, well, it must have been about 17, 18 weeks of pregnancy, you've already changed mentally and physically so much. And I'd got so attached to my little button already. You know, we've been going for scans every 2 weeks, and then to wait another 5 weeks for the amniocentesis results to come back. I think it's so far into pregnancy, I couldn't have done it.
And yet you did have second thoughts for a while.
Yes.
That was mainly just because of the when it come back to the heart defect. That was the only thing.
I went to go and speak to a friend of a friend who had had a baby with Down syndrome about 30 years ago. He only lived, unfortunately, for about 18 months. He passed away with leukaemia. And his mum was a theatre nurse, worked in hospitals all her life. And she felt that it wasn't fair to have a baby that would have to go through open heart surgery at his age. At the time they were saying he'd need heart surgery between 3 and 6 months of life. She had also gone through every pregnancy she had had. She terminated if the baby came back with an amniocentesis of positive. That's when I came home that day, a very emotionally draining day, and said, OK, we do have two choices. Her aim of that day was to make me have an amniocentesis, to make sure I was making my choices on the correct information, really. I still couldn't go ahead with the amniocentesis, but it did make me think, OK, we do have two choices. Was I just letting myself be carried along? Am I being fair to my baby to have open heart surgery? What's his future? And we had to go back to the hospital, I think, on the Monday after that weekend and tell them whether we wanted the amnio. I think by the Saturday morning I rang the GP in floods of tears. I couldn't stop being sick. I couldn't stop crying. You know, give me some pills, calm me down, I can't cope. And he just said to me, look, you've told me Down syndrome isn't a problem for you. You've told me that the heart surgery has a 95% success rate. What's your problem? Enjoy your pregnancy. And I think that's really what I needed to get on with the pregnancy. I was already so attached to him, and to be throwing up and actually physically vomiting at the thought of not having my baby, that should have been enough to tell me that that's not an option for us.